I hope you've enjoyed today's panel. I found it truly inspiring to be here listening to all these different speakers talk about a range of things that all connect. And I think certainly inspired to be in this venue. And I hope you've enjoyed that. Slightly less inspired by the unique blend of coffee available at this venue. Some of the ingredients for which I believe were sourced from the gardens themselves. But enough about that. Let me introduce to you this stellar lineup. I can say with confidence that we have saved the best till last this afternoon, ladies and gentlemen. To my direct left, Tini is here wearing a number of hats this afternoon, but I'm going to introduce her mainly wearing the hat as a member of the National Advisory Council on the Welfare and Protection of Children in Malaysia. To her left is Tony. Tony is the Managing Director for April, a company we've just heard referenced in the last panel. To his left, wearing the snazzy pair of Levi's, is Manuel, the Senior Director of Global Sustainability at Levi Strauss & Co. And finally, Michael from Novartis. Michael's a Senior Manager for Corporate Responsibility, Strategy and Innovation. So we have three very clear industries represented here from the private sector, and Trini's also going to talk a little bit about her experience in oil and gas, but mainly be representing kind of civil society on the panel. Lots of things come under people, and of course, the whole flavor of the SDGs are all about people and planet. But I'm going to ask each of the panelists to start by opening up and introducing themselves and their companies and the work that they're doing under this particular theme, and particularly talk about some of the challenges they're facing in implementing kind of people-orientated programs, but actually be clear and concise in telling us what it is that their company is going to do on the back of the SDGs now being released in the future to really bring about change. And then we're going to have a discussion about some of the things that they're talking about, and I'll hopefully have technology on my side. We have 8% of the iPad battery left, which is perhaps an indication of many other things. We have 8% of the day left, perhaps, 8% of the energy, 8% of the iPad, and I will try to make sure your questions are put to the panel as well. So let's start at the end and come back and give Trini the last word in this opening round. So Michael, over to you.
Thanks, Tim. Being a pharmaceutical company, I believe there's an obvious link between one of the SDGs and what we do as a pharmaceutical company, which is manufacturing innovative medicines. So when you look at our strategy, we have... Does this work? I don't think that... okay. I would have struggles to entertain this whole room with my voice. So, our strategy links in principles by two pillars to the SDGs. One of our strategic pillars is that we want to improve health outcomes for patients with science-led innovation. And the other dimension is that we want to lead in growing fields of healthcare. And of course, emerging markets like low and middle income markets are then here in particular focus. And the truth is, although these markets are very attractive from a growth perspective, they are also affected by huge, huge issues in terms of healthcare delivery and healthcare infrastructure. Now, from a CR strategy perspective, we aim to reach more patients. And here you see a clear link to the strategy of Novartis that I just briefly alluded to. Now, when I talk about the CR strategy of Novartis, I think we are not working with a very traditional approach, which was mainly about donations and charity. From a strategy perspective, when I talk about reaching more patients, we try to do this with a portfolio approach. And this portfolio approach is very much looking at different income segments, which then are giving us certain kind of informations about the healthcare scenario a patient is living in. So when you look at the patients at the top of the income pyramid, our main business is our main instrument to reach more patients and satisfy the SDG related to healthcare. But then when you go into the middle income, we have a generics portfolio which is delivering affordable, high-quality medicines. When you go even further down, we have so-called social ventures. And when you even go down to the base of the pyramid, we operate with philanthropic interventions or donations. So for us, the question in terms of how do we achieve the SDGs or contribute to it is not whether we do this with a more classical approach of philanthropy. It's really about this portfolio of different interventions that helps us to contribute to the SDGs. One thing is important in this context. The social ventures are the areas of our focus because we believe when you look at the challenge, the number of people that don't have access to medicines or appropriate healthcare, which are millions or even billions of people, we need scalable solutions. And therefore, business-minded solutions are our key focus and the core of our activities.
And the SDGs, Michael, we've heard in the previous panel about them giving us a second or third chance, as Simon was saying, to work and support government national plans in this realm. Do you see the SDGs as being helpful in your particular case as a company in having that conversation with government?
You know, I think they were hugely helpful, but mainly in terms of focusing the internal conversation. Now, when I look back at the history and the genesis of the SDGs, there was always a big debate on malaria and tuberculosis as an example, the infectious disease. And Novartis, you know, we have delivered more than 700 million treatments over the years from an antimalarial compound than we have in our portfolio. But when you have something like the SDGs, the whole debate in the company is focusing on concerns that are apparently not just internal concerns, but concerns of society in more general terms, which I believe is very helpful. Yeah. Having said this, I will bring now a counter-argument with regards to the particular focus of the SDGs on health. There's one gap, I believe, and this gap is that the SDGs on healthcare are mainly focused on infectious diseases, where when you look at the global epidemic and how this will develop, the disease statistics, it will be mainly about non-communicable diseases like cardiovascular, diabetes, cancer, and respiratory diseases. Just have in mind that roughly 28 million people are already dying today in low and middle income countries because of non-communicable disease, which is the biggest driver for deaths in those countries. And therefore, we said as Novartis, let's set a counterpoint to this whole focus, and we launched an initiative, Novartis Access, in the context of the General Assembly, which is focusing on those diseases and which aims to be a commercially sustainable business model at the level of $1 per patient per treatment per month.
Thank you very much. So business models and creating more sustainable social business models that governments are able to actually help support and implement, is that relevant, Manuel, in your industry? Tell us a little bit about Levi's and how you're taking your responsibility agenda forward within the SDG framework.
Yeah. Can you hear me?
Yeah.
Okay. Well, in our case, it started after 20 years of driving what we consider a leading program from 1981, our code of conduct called Terms of Engagement. And after 20 years, we asked ourselves the question, 2011, is impacting workers' lives? And the answer was, well, there is a lot of things that we can do. It was not enough. And at that point of time, when we look into MDGs, we use MDGs as a, well, inspiration source, because we pick only 5 of them. I mean, we cannot do all of them. We cannot take all the targets. And at that point of time, what we realize is that when looking to the MDGs in our context, is that the communities and the families of those workers were not impacted. So, one of the key fundamentals, at least in the apparel industry, is that we have those code of conducts, but we usually don't talk to workers. And we performed quite extensive worker surveys in different countries of the world, and we were able to identify what the needs are. And we were quite surprised, because in some of the cases were not even in our programs. Or we were working on them, but just in a marginal way. So what we were able to do in the last couple of 3 years, and still a lot of work to do, is to bring this compliance work and the philanthropic or sustainable development work under a business program. And that's what we are doing today. So basically, a vendor is not responsible only for what is happening inside of the factory walls. He's responsible as well to work with the communities and to support those families. I know that sounds too bold. Of course, we cannot do it alone. and we need a lot of collaboration from other brands, cross-functional, in the apparel industry, outside of our industry, governments and other groups. But that's the approach that we've been taking, bringing both worlds together. It's not easy, but we already set targets, and the Millennium Development Goals, or SDGs, now help us to really set our targets for 2020, where 140,000 workers will be impacted in a positive way in those programs, and 80% of our global volume is going to be done in suppliers with those programs in place. So that's our story.
Yeah.
And well, probably to share that the areas, one of the areas that we identified is health, environment, gender equality, economic empowerment, and education. So I think that several of them fits what has been discussed today.
What was the time period from moving the company to the position you're in now, where you're blending that compliance and philanthropy strategy?
So
just to give us an idea.
It took us at least 3 years.
About 3
to
years.
get there.
That sounds quite quick.
Yeah, well, you need to go through worker surveys in different countries. You
Yeah.
need to get those vendors in place. You need to learn from those results. Very challenging to find local partners in countries where that topic is probably not in the agenda or is considered difficult by different.
It sounds like you did it quite quickly, actually, in terms of your footprint and what you're trying to set out to achieve. So I'm giving you a sort of veiled compliment there.
Well, we set up the program quickly. To deliver all the program, it will take us.
I'm sure there'll be some questions about that in a minute. So let's just move down the panel. Tony, give you a chance to talk to us a little bit about April and your strategy and how it fits into SDGs.
First of all, probably I'd like to talk first about the people as we discussed here. How we are very focusing on the people. First, there are a couple of reasons actually. First of all is that our founder's vision is that any operation of the company has to be good for the community first, has to be good for the country and to the company as well. So community comes first, and then country, and then the company. The second reason is actually the business reason itself. This is also related to the SDG itself, where if we invest in education, and if we invest in the health, of course, and if we invest in the SMEs, then we will get the result of having a good people there, a healthy people, which can be our employees, that can work for us, so we can have more local people working for us, so we can, to eliminate the expatriates and replacing them by the local people. And from the business point of view, we will have the more stable and shorter logistic supply to us. And for example, like until now, we have already established more than 200 SMEs,
right,
and which employed 5,000 people already. And also they supplied a good quality, for example, like cocoa peat for us, because we planted 150 million trees every year. So we use that cocoa peat as a media, and it is supplied locally. So that's how we see the importance of the people in our areas. Of course, our employee as well. Our employees being it's our main asset. We have 25,000 employees in our area, so we try to increase their knowledge about everything. About the technicality, about the other issue as well. So with that, we try to implement what our founders always said, that the 3 C's principle, which is good for the community, good for the country, and good for the company.
Right. And with the SME work that you do in terms of supporting SMEs, and is that kind of business critical? Would you say it's one of the highest priorities of April to actually grow like smaller private sector and have those relationships? We heard earlier that big business is not on its own going to bring around big change. So it's about the rest of the private sector that's not covered by some of the companies represented here on the panel. Would you say April would prioritize SME development as?
Yes, actually, it's initially when we started doing that. It's not an easy thing to do.
No.
We need a lot of effort to try to educate them, to train them, and not only about the business, the technicality about the services or the goods supplied, but also how to manage their financial situation. So whatever they do, actually, what we try to teach them is that they have to make profit.
Yeah.
Initially, we lend them money, but we cannot do it all the time, right? I mean, we then try to channel them through our banks, and they have to be able to have a feasibility study or a bankable feasibility study to be able to get a loan from the bank. And after a period of time, their services is being more and more acceptable to us, and now we are relying very much on them. So we are expanding their knowledge as well, their professionalism, so that so it is included in our supply chain.
Right.
So it is included. It's part of the SDGs requirement, right?
Yeah.
To include the local people in our supply chain.
Right. Just before Trini, I come to you, just on this question of big business not being able to bring around big impact. Manuel, can you say a little bit about your companies and how you are going to move that dynamic forward? So what are Levi's and Novartis planning to do in terms of the responsibility you have as large multinational corporations operating in countries in this region, in terms of some of the SME capacity building that Tony's mentioned, in terms of getting your company to be sort of sustainable profit-wise, but also socially and environmentally impactful. How do you balance your responsibilities there? Where do you stop in terms of being able to support local business, to be able to work with SMEs? How does that play out in Asia? Big question, but maybe just a couple of quick thoughts back on that.
Well, subject matter experts, that's probably one of the biggest challenges that we have at least in the apparel industry, to find local SMEs that really can deliver what we need. Because at the end of the day, every single location is different, and you need to customize and invest a lot of resources and time and knowledge in order to build up that capacity. So when we are talking about countries like Pakistan and HIV/AIDS, okay, you need to find partners. How do you do that? Where are they? That's one of the biggest challenges. Our approach is to rely or to work with our local vendors, so they know better who is around, who can be the right person or the right SME to collaborate. But also, and most important, is that if we don't have the right SME, at least we can build up that capacity and get an agreement that they will get there.
Right.
So at least we can work together. Yeah. Otherwise, there is no option.
Oh, excellent. Michael, anything to add from Novartis' perspective on?
Yeah, maybe just, when you go to certain countries, we are not a big company. We are almost a middle-sized organization in these companies. They are much bigger players when you look at certain countries than ourselves. But having said this, I believe what is most important, next to what Manuel said, is that we as a global company stick to certain standards that are globally expected from a global multinational company as Novartis. And by being sincere in our attempts to fulfill this commitment, to uplift the whole debate in a country and pull the others into a conversation, and by the way, not just companies or SMEs, but also civil society and NGOs and government. Because, the illusion that business, whether this is big or whether this is medium or whether this is small, will improve the situation alone is pretty naive. So what we need to have is a situation where this dialogue is unfolding, where certain kind of interpretations that are acceptable about moral norms and values are really put in place. And then, the whole community follows and tries to implement it.
Excellent. Thank you very much. Right. Oh, Tony.
I'd like to comment a bit
please,
on what Manuel said. It's true that, every country has different difficulty level. Not only every country, actually. In Indonesia even, every island has their own difficulty level. For example, like I've been working in Papua, Sulawesi, and Sumatra. There's a uniqueness of each community there. Yeah. And each difficulty has the special way how to handle it. You cannot generalize everything. So you have to know about the local knowledge is not hard to do.
Yeah.
But for local wisdom, you have to live with them.
Yeah.
You have to live with them. You have to understand the value of them, and then from there you can try to find out what's the best to try to educate them.
No, I agree, and this has come through in a number of panels today. And Manuel, yes, add to that.
Building up on what Michael just said, one of the challenges, at least in the apparel industry, that we found is that every single brand comes with their codes or their guidelines. And it's very challenging to agree at a guideline or policy level. So in fact, we never agree at all. I mean, it's very difficult. And once you go into once you face the issue, wastewater issue or a health issue, everybody tends to agree at a 99%. And I think it is a very important point at the time of collaboration, that successful collaboration, that today, in our opinion, I think it is more transactional, because you get into the issue and reactive. You get the issue, you fix it, but later on the industry and the different players go back to the original places. There is a level of when corporations and NGOs and all of us, we need to give up from some of our agendas in order to fix that specific issue. In the
so
field. It's key critical.
Seed control over things that... Trini, let's bring you into this conversation. We wanted to hear first from the corporate sector part of the panel, but of course you're here representing a number of different things. So maybe you can give us an introduction to that and respond to what you're hearing.
2 points of observation, first of all. The first is, when we talk about social investments and partnerships amongst the different sectors, we only talk of 3. We talk about the government agencies that are involved, we talk about the NGOs, and we talk about the business or the corporates that come in, but we never talk about the communities. They're equal partners as well in this whole social issue. Don't forget that they are bringing to the table the information that you need to be able to work on the issues that you want to work on. So, and that is one of the biggest problems, I think, in looking at sustainable programs and projects that you work in, that you forget that the community you work with are equal partners. It's not an unequal relationship. That's one. Number 2, if we look at issues like social climates or education or poverty, we somehow always forget children and youth. The truth of the matter is 1.9 billion people in this world are between the ages of 10 and 25 years old. That's 27% of the population who are living here, of which, out of 48 underdeveloped countries, most of these 48 underdeveloped countries have populations who are all below 25 years old. So you need to involve them in the issues. You need to get them to be involved and be actual stakeholders in the issues that we're talking about here. I happen to be a child activist as well. So my focus is usually children, and access to education is one of them, because marginalized children don't have equal access to education and health, etc. And so therefore they're behind. But the truth of the matter is, when you work with marginalized children or youth, they have a lot to contribute. It's just that they need the space and the skills to be able to contribute, and we need to provide these opportunities. And they have a lot to say, and we don't do it.
Thank you very much. Let me just re-advertise the fact that Wi-Fi, I think, is now working. So if you want to post some questions while we're going through the second half of this panel, please do. I'll endeavour to eke out the last percentage of battery on the iPad to field those to the panel. Before we do that, we're getting into the subject of collaboration now. So let's have a few comments from each of you about your experiences of that. So maybe, Trini, you'd like to sort of kick off from where you left off.
Yeah,
tell us a little bit about some of the pitfalls as well as some of the opportunities.
Sure. I belong to a corporate called Sapura. It's an oil and gas company. It actually has about 15 different companies that look at different things. And as the CEO of the foundation, I'm part of what's known as the Funders Roundtable in Malaysia, which basically makes up about 30 corporate bodies and funders who actually look at different issues. And what we try to do is align all our programs and our resources on one issue. Right now we're looking at education. The next one is environment. But we don't try to duplicate anything. We don't actually spend a lot of money. It's just aligning all our resources to be able to look at an issue. So right now we're working in an area called Klang, which is about 20 miles outside of KL, 40 miles outside of KL. And we're looking at secondary schools, and we're looking at retention and job entry programs for very, very poor children in plantations and urban areas. So that's something that's what we're working now. In fact, one of our members is actually in Seoul with the government talking about collective impact and what we're doing. So that's one. And other partnerships in terms of non-profit work, again, going into funders and trying to approach them from a sense of being an equal partner to look at a social issue, not as a charity looking for handouts.
Right.
So that's very important.
Okay. Yeah, Tony, do you have any experiences you want to share about collaboration with others?
for example, like we have our fire-free village program. Basically, it's a collaboration between us, the company, and the community itself in each villages, as well as the civil society to help us in facilitating that. And it shows a good sign, a good result, a very good result. I mean, not to mention also the other collaboration that we made with the community and government and NGOs on other issues as well. I mean, usually the community is represented by the NGOs, the local NGOs especially. So what we are doing now, I mean, we meet regularly with them. We meet every month with the local NGOs to discuss various topics, various issues, and try to get the common understanding, and to some extent also we're asking their advices on how to deal with certain issues that they are more qualified than us.
Right.
So that's very important, you know. I mean, we are companies, you know, we know how to do business, but, you know, the NGOs, they know about something else better than us. Right?
And are there lines of accountability in those conversations? I mean, are you as a company publicly kind of accountable to delivering on certain partnership conditions?
Of course, we'll be happy to also sit down with them and also to publicly open it to public, right?
How about in the case of Levi's? I mean, how accountable can you be as a company when it comes to social change? I mean, through partnerships, you can presumably pass the buck to somebody else and say that's their responsibility, or
well, it's a shared responsibility. At the end of the day, we take our piece, but we need the others to do the same, and that's where the difficulties start sometimes. I mean, how a vendor, how the local government, how different players can take that responsibility, and we reach a level of agreement in how to do it. Beyond what has been said, I think there are a couple of things. One, and has been mentioned in the previous panels, it was trust. I think that trust is important, and in order to drive trust, we try to do it through transparency. So, for example, all the worker surveys that we do is an open source. So everybody can access and see what workers said. And it can be, from health issues, community, family, children, everything that they said is already there, and is what we are using as a source of driving this. The second point is effective collaboration, because I've seen a lot of collaboration in more than 15 years of experience that, okay, everybody gets excited, things goes up, and later on it's go down or disappear, and the project disappears. So the question is, in that level of partnership, in those discussions, be very clear what is going to be the final deliverable, which is that community or that family or those workers, those improvements are going to stay. Right. And that's the difficult discussion, because at one point of time you talk about money and all the different type of conversations, but that's the final deliverable, because at the end of the day, supply chains are flexible, and in 10 years' time, or in 5 years' time, or in some cases in 2 years' time, nobody can say if they're going to be there or not as a business.
Right. And Michael, in your industry, how important is it to try to conform to industry standards through partnership, and how important is it just to do something that you think the company believes is the right thing to do, and kind of take a stance as a company rather than representing an industry when it comes to partnering?
If you allow me, Tim, I would maybe not talk about industry standards, but more about collaboration and why it's so much needed in our sector. Let's just look at the following scenario. Imagine you are in a low-income country and you are a patient and you feel unwell. So you try to seek a doctor. The next doctor in a primary healthcare facility is maybe 20 kilometers away. So you have to walk 20 kilometers because you're a daily laborer, you lose the income of the day. Now you go to the doctor, but maybe the doctor is not qualified to make a proper diagnosis. So he directs you to the next city, which means you have to maybe go for 40 kilometers or something like this. Now, suddenly, at the end of the day, you are in a tertiary hospital, maybe in the capital of the country, and you have the chance to find one of the 3 oncologists in this country. That's a pretty miserable scenario. Now, we as a healthcare company, again, we want that the patients for which we have medicines for their diseases, that they actually get it. But in the scenario that I described, it's obviously the case that you need many different players that do their part in order to have a proper diagnosis with a doctor which is qualified to do this, close to the patient, so that the patient really gets what he needs. So for us, it's very, very, very important to have the right partners in place, whether this is the government, whether this is an NGO, which is maybe doing disease awareness trainings in local communities. However, having said this is very difficult to align. It's very, very difficult. And one of the reasons, and that's just one, is the scale asymmetry of the partner organizations and ourselves. We are a global business. Typically, when we start doing something, we want to do it at global scale. Many, many players that have great skills are not operating at the same scale as we do.
Right.
And if you have such a scenario, it's difficult to grow at the same level of speed, at the same level of dynamic, and also aligning objectives and targets, as you said. And don't get me wrong, this is not to say we shouldn't do it. I said explicitly we should do it. And in Novartis Access, the initiative that I briefly alluded to, we are looking for partners because we know that we can't deliver the solution we have in mind ourselves and alone. But it's a very difficult challenge, and we really need to get a better idea how to align the targets and make things real on the ground.
I have a follow-up for you. I'm going to come back to the rest of the panel, but just opening up to the audience now with the use of my fairly rubbish smartphone, if I'm honest, because the iPad's died. But Michael, there's a specific question for you here, which is relevant to what you were saying, which is how is Novartis engaging advocacy groups to reach its SDG commitments? Do you have anything you can say in response to that in 30 seconds? Or 60 seconds?
What kind of advocacy groups? There are many. Patient groups or what?
Is the person who asked this question still in the room? Yes. Would you like to just be... There you are, patient advocacy.
You know, we try to work quite a bit with patient groups. They are important for us. They are important for us because they have a voice which is meaningful, and they know actually what it means to be a patient. So they can give us a lot of insights and knowledge that help us to deliver better solutions for the patient. So advocacy groups are important for us. Yeah.
Okay. We have another one. So just because you're totally warmed up now, Michael, on the subject of healthcare delivery. The question is this, so is there a fortune at the bottom of the pyramid? Could you make a profitable business providing health and education to the disadvantaged communities, or is it a gap for government and non-profit?
So it depends a little bit what you define as base of the pyramid. But we have started in 2007 a social business in India, which is targeting an income segment of $2 to $5 a day, which I would deem is pretty much at the base of the global income pyramid. And this model that we started in India rests on two pillars. One is that we try to sell the medicines that we believe are needed in these rural communities. And the other pillar is that we do health education. To our own surprise, to a certain extent, this model broke even after roughly 30 months. So we have shown that you can do it on a profitable basis. And also because of this reason, we expanded this model to 3 other countries, which is Kenya, Vietnam, and recently Indonesia. So I don't think that we should be dogmatic in any way and say this is the play for governments and NGOs, and this is not our play. I believe we as a business have to challenge ourselves and say, maybe traditionally we thought that this is not a market where we should play, but maybe we can do it. And we tried it, and we have done it. And with Novartis Access, we tried to do it again with a different approach, with a different model. But I think that's our playground as well, as the top tier, the creamy layer of Mumbai or Delhi is our playground. But the innovation that we need from a business modeling perspective is not there in general terms in industry. I think, again, we have to challenge ourselves and be much more innovative and drive business model innovations at scale.
Yeah. How does that resonate with some of the rest of the panel in terms of the industry standard being set at a certain level and you as a company perhaps aspiring to do above that? Is that the same in your experiences? So in clothing manufacturing, are you looking at industry standards as the aspiration, or do you feel as a company that you can go above and beyond that in terms of social responsibilities and impacting people?
It is quite similar of what he says. I mean, that we are following the same type of approach, and I guess that we are facing the same type of, because we've been talking, we face similar type of limitations.
Yeah. And how do you work around those? You just have to stick to your guns and give it more time, convince people in the company high up that this is the right thing to do when they're pulling you down and saying, is this making us profit? Are we wasting our time?
Well, from a company point of view, I guess that, well, I think we are a more than 150 years old company and still privately owned. So we are probably in a much better place than many other companies in the world because it's part of our DNA. So certain type of discussions, are quite easy in terms of sustainability and especially looking to the future or related to social and people. So that's something that is important. However, when facing those challenges, and Levi, has been a pioneer company in areas like, for example, HIV/AIDS in the 80s when our CEO was giving pamphlets when nobody knew about the issue in San Francisco, and it was a weird illness in the gay community. Those are the key milestones that we have as a heritage. So that's, I think it is, of course, you need to go through the discussion. There is a business case always asked, but in some cases it's the right thing to do.
Yeah.
And we don't ask even the question. You just do it.
Can April stand up and say the same thing about where you're coming from?
Social responsibility, I think, as I already mentioned earlier, that we are very committed to that because we believe that there's no company that can survive in a community that fails.
Right.
So we have to grow together with the community. For example, like when we started our operation there, when we built our factory in Pangkalan Kerinci, it was only like 200 households there. Compared to now, after 22 years, it's now become 150,000 people. So you can see the growth is because our operation there can attract people, come and then, they have jobs, they have works to do and supporting our business, and also the multiplier effect of our operation can make them in a better quality of life. So that's why more and more people are coming there.
So a symbiosis, really, for like a win-win is what people seem to talk
Triple
about.
win.
Trini, we have a question which I think we can direct towards you to start off with, and the panel can chip in. The question is, how do we make sure people are enabled to pursue their economic aspirations within sustainability parameters, given that they may not have the knowledge and the resources to do so? So how do we, in the case of the work that you do with young people, how can we better bring knowledge and understanding about those opportunities down to the younger generations?
I think you have to provide, well, what we try to do is to provide spaces, whether it's through projects or workshops, to look at and encourage young people and children to look at different ways at approaching an issue. We talk about spaces for innovation, spaces to be able to say, to advocate. I think we need to look at young people, but even the communities themselves. You have to remember the end goal. The end goal is to empower them to do for themselves, and then we as businesses move on. That's the end goal. You don't want to stay there forever and ever. But I think for these communities as well, empowerment is one, and empowerment through innovation, empowerment through creating these spaces for them to be able to speak, to advocate, to be change makers, to be policy makers. That's part of it. I think that's part of change, and I think businesses have a huge role in being policy maker and change and advocate makers as well. I think there's a huge part for businesses to look at that to create more social change. I think.
Would anyone like to add to that? So businesses as policymakers in society, how does that feel to you three?
Well, I think the policies should be done by the government, or by the regional or the local government. We have an important role to play, of course, as one of the key stakeholders. But probably, collectively we can bring them up and show them what is the case. But I think that the final decision makers are the local, the regional, or the country government, but not the businesses with themselves.
Yep. If I may add, speaking about policy between the company and the government, I think the government social responsibility is written in the Constitution, right? So actually the government is the one who has the responsibility for prosperity of the people. But, when company has that kind of commitment to do that, it should be complement to what the government did, or to what government plans to do. For example, if the government is planning to build 100 schools in various regencies, then if the company has an operation in certain regency, then it will add more school there, not shifting the issue to the company.
I'm going to disagree a little. I think right now, the way things are in the world, resources are scarce, collaborations and partnerships are emphasized, and we need to look at ways in which we can create sustainable long-term change. Businesses, you can give funds, you can give things, but the funding is not the only way to create social change. I think businesses have an opportunity, and as well, I think they should look at the responsibility of being able to support advocacy and policy to change whatever it is. If we talk about social climate, for example, we need businesses to come in to help to create these changes, and through policies and advocacy. I don't think it should be the responsibility of one agency or another to do this.
And I think that we agree. I mean, absolutely.
You're violently agreeing with each other.
I mean, the thing is, the thing is, you have policies and advocacy, and as collectively we can drive it. But at the end of the day, the one who takes the decision is the government or the community. So but we agree completely, and we have cases. In our case, in Cambodia or in Bangladesh, what we've been advocating for increasing wages. So I think that those are two clear examples in the apparel industry during the last 4 years. So I think that we are completely aligned.
And I really like Michael's point earlier about this nebulous kind of description and language you use about multinational corporations, and actually you might have a large footprint and a large headcount, but in some countries, in some contexts, really your knowledge is not there, your history is not there. You're playing in a space on a very kind of much more equal level. You're not really there as a multinational corporation in terms of that size connotation of that. You're there as an actor and a stakeholder in the ecosystem. And I think that's quite an interesting, for me, takeaway from this session, that we need to be much more specific about the company in question and their intentions, and not sort of pigeonhole them, pardon the pun, in terms of different industries and in terms of their kind of multinational or national status. Just with an eye on the time, but also conscious that because the Wi-Fi has been a bit patchy today, is there anyone in the audience who's not been able to get on to this who has a burning question for the panel before we ask them to close? So there's a hand there. Are there any microphones left? There we go. Anyone else, please just raise a quick hand so I can identify whether you want to ask a question. Okay, there's a lady down here at the front.
Yes, I have a question for you with April. Burning question, you might say.
Burning question, okay.
April committed not to deforest in July 2015, and this was, widely talked about, and NGOs like WWF or Greenpeace were actually acknowledging it, and they were also a little bit cautious, and they were willing to see how it's actually gonna happen. So can you tell us more about the no deforestation policy from April?
Before you do that, Tony, are there any other questions in the audience before we call a halt on that? Just the one? Okay, so Tony, I'll let you answer that directly, and then I think I'll just ask all of you to make a sort of 30-second summary statement about, again, if you have one thing that you're going to do in your company in the next 5 years that sits in this, that you're happy to commit to on a public stage or happy to talk to briefly in summary, then I think that would be great to end this particular session on. But before you do that, Tony, would you just like to give a quick response?
Basically, talking about sustainability, it's a journey for us. We started in early 2000 by donating our area to the Tesonilo National Park, and then we also applied the high conservation value forests, and then resulted in 250,000 hectares being conserved within our concession. And late June, we also announced the zero deforestation, whereby we added HCS into our HCV, the high carbon stock assessment, into our HCV areas. And we halted all natural forest harvesting since May 15, 2015, this year, since May 15 this year. So, but there are still some adding HCS, and also our commitment to ecosystem restoration. Until now, we have already conserved additional 70,000 hectares. So we have also committed to have a one-to-one commitment, whereby if we plant 1 hectare, then we will also conserve 1 hectare. So now we have already planted 480,000 hectares, and we have already conserved 250,000 plus 70,000 is already 320,000. So in the near future, we will try to commit the equal 1-to-1 for the 480,000. So basically, that's the announcement that we said this year.
I can see your question and making lots of notes or writing lots of follow-up questions. I'm not sure, but I think happy to take that conversation on after the session. Trini, let me start with you this time. Just a couple of quick points from you and the rest of the panel in summary. So where do you see this whole agenda going forward in the future? So in terms of what you've been describing, what sort of action do you think needs to happen?
I think we definitely need to, I'm hoping, that we include children and youth in decision-making, in social change, and that we actually have a space for them to be able to contribute and to find different solutions to problems that adults maybe don't always know. That's one. And number two, please include the community that you work with as an equal partner. It's not charity. They're actually they're social investors as well, and they're actually also the experts on what's happening on the ground, not just the NGOs.
Thanks. That's two fantastic takeaways. Tony, last thoughts from you?
To me, I think for Indonesia, actually, I would ask the more companies, not only the natural resources-based companies, but more companies doing what they call not only community development programs, not only charity programs, but how to improve the quality of life of people. I mean, the human development and index of the people, at least in their surroundings areas. And second of all, I think the most important that has been discussed in the earlier session is the one map policy. I mean, one map policy for everybody and for everything, including for the local people and indigenous people as well.
Thank you very much.
Yeah. On top of probably a couple of points, I think the one key critical is going to be the expansion of the scope by the different, from a corporation, to expand the scope of the different programs that we have in place. I mean, is very important. The second one, as I mentioned before, transparency, open source, how you communicate what are the results and be more accountable in the public domain about what you do and what is happening in your world. And the third one, I think that the policy piece is going to be critical as well, that can be only achieved through collaboration.
Great. And Michael, final word to you.
Maybe three comments, of which one is more strategic and the other is more operational. I fully take what Tini said, and that's a strategic remark. If we would really deepen our footprint in low-income segments, we really need to understand how a patient journey in these income segments looks like. And without really understanding communities, as an example, we can't do this. So we need to better understand these contextual factors of a patient in low-income segments that will then allow us to build these innovative business models that I'm so keen for to develop in the future, because I believe they are giving us the handle for scale and replication and for reaching many, many more patients in the future. The other point is a more operational from a business perspective. I believe in companies we have to be much more practical in terms of linking these SDG-related objectives or sustainability goals into the incentive schemes of companies, because these are typically the elements that are driving decision-taking and behavior in companies. And just having a nice Christmas speech and believing that people do things because they are just good things is pretty naive, because the pressures in business are looking differently. So linking this whole debate into the contextual factor of a manager, which is very much driven by incentives, career prospects, etc., is the right lever that we need to use in order to make things real in the business. Last but not least, in terms of what I have on hands with my colleagues for the next few years, is really making this Novartis Access, this social venture, a success. This is disruptive in the real sense, offering a portfolio of 15 off and on-patent molecules to governments and maybe NGOs at an average price of $1 per patient per treatment month. That's really, really disruptive. And making this real is a big challenge, but we want to do it. And that's a big task on our hand for the next few years.
Thank you very much. I think disruptive initiatives is a fantastic theme to end on. Let me ask you to put your hands together for what I believe is one of the most insightful panels of the day. Thank you very much.